Hey, this is Dr. Dickerson, and we've got a question here from Morganton, North Carolina, from Mirage 456, and they write in and talk about some horizontal depressions over the beginning of the eyebrow, just over the arch, and what should they do? Well, Morganton, this is going to be a little tough because we don't have any pictures to reference, but let's see if I can answer some of the anatomy questions. Essentially, there's three areas that I usually use for the upper part of the face, and remember, Xeomin helps wrinkles of animation. So it's the crow's feet, it's the midbrow or the 11 signs, the 111, and then also these horizontal lines. Now, when I usually will do my consultation, I'll ask the patient to lift their brow. And right where this peak is where we want to keep the wrinkle blocker. We don't want too much wrinkle blocker out here because we want to sustain the lifting muscle of this frontalis muscle. If we get a little bit out here too laterally, we don't want to make sure that that drops. But also doing so, there's a compromise. There's always going to be some lines out here because when you lift your brow. Now we want essentially the horizontal lines in the middle to be rested when you're having conversation so it doesn't look like you're thinking or you're mad. So once again, there is a balance. And sometimes it's just a matter of your local injector learning your face. So we usually have patients come back in for about every 2 weeks after their first treatment to do any touch-ups. We usually do it on our dime, but it allows us to get the best placement for the results that they're expecting. So Morganton, North Carolina, I hope this answers your question. Hope to see you soon.